After studying this module, you shall be able to know about aging and its impact on muscles, bones and joints of body. Understand sarcopenia in terms of its causation, symptomatology and treatment. Understand the pathogenesis and physiological changes in osteoarthritis with aging. And learn about the etiology, symptoms and prevention of osteoporosis. Aging is a process marked with various physiological changes in the body. It is associated with insidiously progressing degenerative changes in organs, tissues and body systems. Etiologically, both genetics as well as environmental factors are responsible for causing these changes. The genetic component explicates why different people of the same age group show different rate of degenerative processes, and environmental factors comprising of lifestyle, diet, nutrition, exercise and exposure to contaminants and microbes explain the influence of external agents responsible for the process of aging. Broadly categorized, the process of aging affects physiological systems in three ways. Firstly, with advancing age, the body's homeostatic mechanisms are affected, which are responsible for maintaining balanced, steady state equilibrium in the body. These mechanisms include regulation of blood volume, temperature regulation and maintenance of extracellular fluids. Secondly, aging results in overall diminution of body organ mass. And third, body's reserves start depleting at a fast pace, due to which overall immune mechanism grows weak with increase in tendency to trauma and infectious disorders. The current module details about the physiological changes in musculoskeletal system of the body associated with advancing age. Aging marks changes in muscles, bones and joints of the body and results in various disorders. First of all, let us discuss the age-related changes in muscle fibers. Various age-related changes in the muscles of the body are reduction in muscle mass, decrease in number of muscle fibers, decline in muscle size, reduced muscular tone, diminished contractility, deposition of fibrous tissue and fatty tissue, reduced blood supply to muscle tissue, and reduced ATP production for muscle metabolism. Second, let us discuss the age-related changes in the bones. With growing age, bone that gives structural framework to the body also exhibits various changes. The significant changes are loss of osteocytes or bone cells, reduction in bone density, decrease in bone mass, and loss of minerals like calcium and phosphorus. Thirdly, let us discuss the changes in joints. Significant age-related changes takes place in joints, ligaments, tendons and cartilages, resulting in limitation of movement in the elderly people. Some of the marked joint changes are loss of flexibility, reduced synovial fluid that gives lubrication for smooth movement, thinning of cartilages, loss of tone in cartilages, shortening of ligaments, degeneration in articular cartilage and reduced space between the bones. As a result of the above mentioned changes, muscular activities of the elderly become restricted, leading to various age-related musculoskeletal disorders. The current module explains three age-related physiological disorders in terms of etiology, symptoms, complications, treatment and prevention. The disorders covered are sarcopenia, osteoarthritis, osteoporosis. Let us first discuss sarcopenia. Aging is characterized by wasting of muscle mass of the body with reduction in the strength of the muscles. Muscular atrophy is associated with replacement of some amount of muscle mass by fat deposits, leading to the functional immobility. Clinically, the disorder is termed as sarcopenia. The term sarcopenia is derived from the Greek word sarx, meaning flesh, and penia, which means loss. The disorder first named by Rosenberg is characterized by the loss of muscle flesh in the process of aging. The disorder begins to show its appearance in the third decade of life and advances with the growing age. Between the ages of 65 to 80, the disorder progresses very fast and may result in frailty, which becomes the common cause of trauma, accidents and fracture in the elderly. The symptoms appear early in the physically inactive individuals in contrast to those who do regular exercise and remain active. Research indicates that sedentary lifestyle increases the progress of the disorder and brings early decline of muscle mass and strength. The etiology of sarcopenia is that although exact causal factors are unknown, following factors have been found to be associated with the disease. First of all, the disorder is found to be profound in people with less physical activity. However, it is noted that regular activity does not exclude the possibility or the probability of the occurrence of the disease. Reduction in neuronal mass with growing age results in delay in synaptic transmission of neurochemical signals from the brain to the musculoskeletal fibers, thus delaying the movement. Age-related diminution of hormones in the body like growth hormone, sex hormones and pancreatic hormones. Next is the diminished protein synthesis in the body with reduced dietary intake. Also, insufficient dietary intake of essential minerals like calcium, phosphorus that are essential to build body muscle mass. The figure shows the normal muscle mass which is in the left and the muscle wasting or sarcopenia in the right. Let us now discuss the symptoms of sarcopenia. The disease is characterized by the loss of muscle mass and strength resulting in symptoms like weakness, fatigue and low vigor, diminished strength in the muscles and gradual loss of mobility. Treatment and prevention. The main aim of the treatment is to restore muscle mass and build strength. For this, elderly are advised to increase their mobility and engage in regular walk and exercise regime. In particular, strength training exercises that build muscle quality and perseverance with weights has been appeared to be valuable for both the avoidance and the treatment of sarcopenia. Resistance training emphatically impacts the neuromuscular framework, hormonal indices and protein synthesis rate of the body. Studies have demonstrated that a well-designed program on endurance building with weight training can prevent the loss of muscle mass, build protein reserves in the body and slow down symptoms of the disorder significantly. Let us now see the complications. Progressive muscle wasting can affect the muscles of the gastrointestinal tract and urogenital passages resulting in constipation, incontinence of urine in the elderly people. Reduced muscle strength of the respiratory passages leads to difficulty in breathing and frequent respiratory tract infections. Let us now discuss this next disorder, the osteoarthritis. Aging is related to various types of degenerative changes in joints resulting in arthritis. Defined formally, arthritis means inflammation of the joints of the body characterized by pain, tenderness, redness, swelling, stiffness and loss of function of the joints. The most common form of arthritis seen in the elderly people is osteoarthritis or OA. It is considered to be one of the most common disorders of the elderly. According to the Centers for Disease Control and Prevention (CDC), OA affects more than 25 million men and women over the age of 25 in the US, that is almost 14% of all adults. Osteoarthritis is not considered as a single disease, but a group of disorders that results due to structural or functional failures of one or more joints of the body. It is a progressive disorder that mainly affects the larger joints of the body, but smaller joints are also involved in the later stages. Some of the characteristic features of OA are: the most prominent symptom of osteoarthritis is cartilage degeneration. The disease mainly affects the larger weight-bearing joints of the body like knee joint, hip joint and vertebrae. It affects both males and females, but it is more commonly seen in elderly females. The disease occurs due to wear and tear changes in joints due to advancing age. Obesity, thyroid disorders, familial tendency and trauma to joints are some of the predisposing factors of osteoarthritis. Let us now discuss the etiology of osteoarthritis. The causation of osteoarthritis is faintly known so far. On the basis of etiology, OA is characterized into two types, primary and secondary. Primary osteoarthritis, also known as idiopathic osteoarthritis, primarily OA, has no known etiological explanation. In almost 95% of the cases, OA remains unknown in the elderly. Secondary OA, the remaining 5% of OA is secondary to some other disorders like autoimmune disorders, trauma, severe infection, type 2 diabetes, obesity and severe muscle dystrophy. OA in such cases result due to some predisposing factor. Let us now see the changes in osteoarthritis. OA is a disorder that affects all the components of the joints. The articular cartilage is the first part that gets affected by degeneration. This is followed by involvement of synovial membrane, joint muscles, ligaments, tendons, muscles, joint spaces, articular capsules and finally the bone. The figure shows the normal joint and the osteoarthritis joint. Changes in articular cartilage. OA results in softening and erosion of joint cartilage. Collagen fibers are ruptured, leading to inflammation and frequent experiencing of locking of joints. Changes in bone. Bone surfaces start getting denuded and hard with advancing changes to an extent that it gets completely devoid of protective layer of cartilage. It is at this stage that an elderly has a risk of microfractures. There is also growth of soft tissue and small bony structures called osteophytes at the joint margins. Changes in synovial membrane. There is an increased cell growth near synovial membrane with effusion of joint fluids. This results in swelling and pain in the joints. Repeated effusion in joints lead to loss of body protein as the fluid needs to be surgically extracted to relieve patient from the swelling and the pain. Next is changes in the synovial capsule. The capsule slowly starts undergoing fibrous degeneration and chronic inflammatory changes set in. It is at this stage that a person is never devoid of pain and experience immobility. Next is the changes in joint ligaments. The process of degeneration also ensues in joint ligaments, further perpetuating chronic pain and limitation of movement. Changes in muscles. Due to pain, swelling, OA joints become largely immobile and undergo atrophy. Muscles get wasted and there is a progressive loss of muscle mass. Joint spaces get reduced with time and at an advanced stage, bone terminals rub together. The patient experiences severe excruciating pain at this stage and at times get bedridden. The main symptoms of osteoarthritis are pain in joints, stiffness and tenderness, swelling of joints, locking of joints, difficulty in taking first step though further steps relieve pain, weakness and fatigue, heaviness of entire limb, repeated swelling and fluid accumulation in joints, limitation of movement, joint deformities especially in hands and great toe, and growth of osteophytes due to which joints are enlarged, and coarse crepitus especially in knee joint. The figure shows the joint deformities in OA. Treatment and management of OA. OA or osteoarthritis is a progressive crippling disorder that cannot be stopped once degenerative changes start. It is important that elderly should be properly guided in terms of management of OA so that the progression of the disease can be limited. The goal of the treatment is to relieve patient from severe pain and swelling while maintaining joint mobility and joint functions. Non-steroidal anti-inflammatory drugs are generally prescribed to relieve pain, swelling and tenderness of joints. Elderly are advised to maintain joint mobility in the best possible tolerable capacity so that the muscle wasting can be minimized. A healthy protein-laden diet is given to replenish the loss of body proteins through repeated effusions. Supplementary calcium, phosphorus and vitamin D preparations are given to control osteoporosis. Patients are also trained to strengthen muscles of the affected joint by strength training programs. Physiotherapy is advisable in acute stages to improve the functioning of joints. Braces, splints, walking stick and mobility devices are prescribed in severe cases where surgical intervention is not possible. Finally, regular counseling sessions are taken with the elderly in order to prepare them to live with chronic pain and manage it. They are also encouraged to control and reduce weight and manage secondary disorders like diabetes. Surgical intervention is essential in severe cases. When joint spaces are completely abridged and bone ends rubbed together causes complete loss of function of the joint. Next, let us study the disorder osteoporosis. Osteoporosis is a predominant disorder of the aged characterized by low bone density and loss of calcium from bones. There is a slow degeneration of bone tissue that results in weak and fragile bones with an increased risk of falls and fractures. The disorder that can occur at any age is most commonly seen in elderly females due to decreased estrogen levels that occur with menopause. Cummings, Black and Rubin in 1989 defined osteoporosis as a disease characterized by the low bone mass and microarchitectural deterioration of bone tissue, leading to enhanced bone fragility and a consequent increase in a fracture risk. Etiology of osteoporosis. Osteoporosis results due to imbalance between bone resorption, the rate of bone loss and the rate of bone formation. The old age is characterized by excessive bone loss. This leads to low bone density and impaired bone quality, which makes the skeletal of the elderly people more fragile and weak and more prone to fractures. Though the primary cause of bone loss with age remains unknown, several risk factors have been identified that are associated with the disorder. Body weight of more than 70 kg and body mass index greater than 21 are two potential indicators of osteoporosis. Besides, smoking, prior history of fractures, use of steroids and early menopause in females are significant risk factors associated with the disease. The disorder is also known to be secondary to other disorders like chronic renal failure, deficiency of vitamin D, hyperthyroidism and Cushing's syndrome. Symptoms of osteoporosis. The disease remains silent till the time significant calcium loss occurs in the bone. Clinically, the disease is diagnosed in older men and women with a fracture that results due to sudden fall. The vague symptoms associated with the disorder are fragility of bones, tiredness and fatigue in lower limbs, difficulty in walking and climbing stairs, impaired quality of life, sudden hip or vertebral fractures. Next, let us discuss the treatment and prevention of osteoporosis. Treatment of osteoporosis is done by giving supplements of calcium and vitamin D to risk-prone aged people. It is recommended that post-menopausal women, elderly with low baseline calcium levels and those suffering with other chronic diseases should be prescribed diet rich in vitamin D. Natural sources of vitamin D supplements like fish, cod liver oil and milk should be given to increase the calcium intake of bone cells, thereby increasing bone density. Strengthening exercises and mobility of the patient should be encouraged. Pain management is done by giving light analgesics. The usage of alcohol and caffeine should be restricted as it decreases the calcium content of the bone cells. Women in the menopausal age group should be fortified with HRT or the hormonal replacement therapy to cover the loss of estrogen and calcitonin hormones in the body. Well students, now let us summarize what all we have learnt in this module. First of all, aging is a process marked with various physiological changes in the body. It is associated with insidiously progressing degenerative changes in organs, tissues and body systems. Aging marks changes in muscles, bones and joints of the body and results in various disorders. Next, aging is characterized by wasting of muscle mass of the body with reduction in the strength of the muscle. Muscular atrophy is also associated with the replacement of some amount of muscle mass by fat deposits leading to functional immobility. Clinically, the disorder is termed as sarcopenia. The most common form of arthritis seen in elderly people is osteoarthritis or OA. It is considered to be one of the most common disorders of elderly. According to the Centers for Disease Control and Prevention or CDC, OA affects more than 25 million men and women over the ages of 25 in the US, that is almost 14% of all adult population. Osteoporosis results due to imbalance between bone resorption, that is the rate of bone loss and the rate of bone formation. Osteoporosis is a disease characterized by low bone mass and microarchitectural deterioration of the bone tissue, leading to the enhanced bone fragility and a consequent increase in the fracture risk.